Blood transfusion and donor screening. Introduction. Blood transfusion is a medical procedure in which blood or blood components are transferred from a healthy donor to a recipient who needs it. This procedure is essential in various medical situations, such as during surgery, for patients with blood disorders, in cases of trauma, and for individuals with certain medical conditions. Process. However, blood transfusions must be conducted with great care to ensure the safety of both donors and recipients. Donor screening is a critical part of this process. Donor screening eligibility criteria. Donors must meet specific eligibility criteria to ensure that the blood they provide is safe. Common eligibility criteria include age restrictions, weight requirements, and general health status. Medical history. Donors are required to provide a detailed medical history including information about past illness, surgeries, medications, and potential risk factors for infectious diseases. This information helps assess the donor suitability. Physical examination. A physical examination is often conducted to check the donor's overall health. This examination may include measuring vital signs, blood pressure, pulse, etc., checking for signs of anemia, and assessing for any visible health issues. Blood test. Donor's blood is tested for various factors, including the type A, B, AB, or O, and pH factor, positive or negative. To ensure compatibility with the recipient, additionally, blood tests are performed to screen for infectious diseases such as HIV, hepatitis B, and syphilis, etc. Iron levels. Hemoglobin and iron levels are checked to ensure that the donor has enough iron in their blood to safely donate and recover without experiencing anemia. Temporary deferrals. Individuals may be temporarily deferred from donating blood from reasons such as recent travel to areas which is affected with the disease outbreaks, certain medical conditions, or recent surgery. Consent. Donors must give informed consent for blood donation, understanding the potential risk and the voluntary nature of the process. Once a donor passes all the screening criteria and tests, their blood is collected and processed for transfusion. Donor blood is rigorously tested for infectious agents to minimize the risk of transmitting diseases to recipients. Um, Donor safety and blood supply quality are of paramount importance in blood transfusion. Stringent donor screening and testing procedures are in place to protect both donors and recipients and to ensure that donated blood is as safe as possible for medical use. Thank you.